how to treat your glutes. But more specifically,
glutes and deep hip rotators,
yeah,
actually. So you kind of can't help getting your deep hip rotators while you're doing this at the same time. And if you don't mind, I'm going to go ahead and just go over kind of why we're treating this. So the reason as to why we're going to treat this is if you're having any low back pain, specifically like right across this like top of the hip, kind of in that soft spot, the low portion of the back here, that's going to be more specific to glute medius specifically, but it's going to be in this area that you'll be relieving some of your low back pain. Also, if you have any sort of like sciatica symptoms, more than likely it's coming from one of these muscles in here, or if you're having any SI joint pain, that's going to definitely come from those deep hip rotators, okay?
Yeah, and if you haven't checked out the hamstring video and you're also an SI joint and sciatic nerve and low back pain,
treat those too.
Yeah, absolutely. It helps. Those muscle groups also help. So you may need to do both of these videos. Awesome. So we're going to get started. Let's go ahead and do 12 squats. You can do the chair squats like we did in the hamstring video if you want, but since we don't have chairs, we're just going to do these like this. So let's have your feet a little turned out this time, just to make sure we really hit the glutes. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And if you're not done, go ahead and finish your squats before we get started. Okay, so remember, we do this to bring in blood flow so that the foam rolling and the stretching is more effective. Now, I am opting to use a ball today and be a little bit more specific in my glutes, especially to help target my deep rotators. So actually, I think the tennis ball isn't gonna cut it. We're gonna use this. And Bree,
I have the foam roller.
Bree's got the foam, actually you got a nice trigger point roller there too. So, first we have to get in position. So go ahead and take your right heel, cross it over your left knee, and that's gonna really open the hip up, okay?
Okay.
Now, whatever your tool is that you're using, slide it under that hip.
Not as coordinated.
And roll around until you find a trigger point. If you can't do this on the floor, we've also provided an option against the wall. And it works just as good. Don't worry about it. Just grab a ball and use the wall if you have to. Now, I'm gonna start this timer because I know we're all in a little bit of pain here.
Just a little, not too bad yet.
Just a little bit. Okay, but I want you guys to roll around until you find something that's on a pain scale of 1 to 10. Find something that's a 5 to a 7. But if an 8 is where you want to pull away, don't go over that 7. It should be releasing pain, not inflicting pain.
Yeah.
And then let's go ahead and hold. Now, if that spot isn't getting better yet, it will. Just give it a second. This takes around 10 to 15 seconds for most people, but
patience and practice.
Yeah, you have to find the right amount of pressure. You're learning. If you're new to foam rolling, especially, you have to learn where your tissue releases. Now, mine's already let go, so I'm going to roll around still really close to where I was at and find another one. Ooh, there's a good one.
And you don't have to move much. Like sometimes it's literally just a hair.
It feels like a centimeter.
Yeah.
And then you're in pain again.
Yep.
Ooh, these are making me sweat. I think I've been neglecting the glutes.
Well, I could use more rolling in my life anyway, but
everybody could. That's why we're doing these videos.
Yep.
Okay, make sure you're moving around. Let's find another one if you've gotten stagnant while we're chit-chatting. And remember, if this is too hard on your wrists or it's too much pressure, use the wall.
Yeah.
Start with the wall. Your glutes may be too sensitive too to use the floor. Just start with the wall if you have to.
It's a good one.
Oh, you found one?
Mm-hmm. And don't be afraid to get right up next to those bones, guys. It might feel a little more sharper once you get closer towards either the sacrum or you get a little closer towards the femur. It might feel a little sharper. Just be careful. There's like we said earlier in past videos, if there's a difference between inflicting pain and relieving pain.
Mm-hmm.
So just find that fine line.
It's a fine line. I'm actually moving up into glute medius right now, and I can feel that shooting all the way into my low back.
And if you'll notice, she's saying that she's moving over to glute medius, and we're actually shifting our bodies a little bit. You can see that we're kind of more at a little bit of an angle now than straight up and down.
Yeah. So you have to get in that pocket.
Mm-hmm.
A lot of our power lifters and a lot of our runners have pain in the glute medius, so this is a really good spot to treat. If you're on a roller, you might have a harder time getting in there. You might need a ball. Can you get into yours?
Yeah, I'm getting into mine.
Good.
And it helps too to look at these pictures that we have scrolling across the screen. Pictures really help make that mind-muscle connection. Once you can kind of visualize what it looks like and where it is on your body, the easier it is for you to kind of tune in.
Mm-hmm. Okay, speaking of tuning in, I lingered in that one. Let's go ahead and switch hips. All right. So I do apologize if your wrists are getting a little tired, if your hands don't like this. Like I said, if this is too much, switch to the wall. Cross your left ankle over your right knee and start to find those 5 to a 7 spots. I have more tension in glute medius on both hips today.
Well, what's really funny is yesterday I was feeling it more so on my right side when I was doing my stretches, but for whatever reason today this is actually more sensitive over here on the left. Body changes depending on the habits that you have.
Yeah, it could have been because of all the driving yesterday.
Yep.
Remember to move around. Once that spot releases, move around, find another one. We're trying to be efficient here. We don't want to get lazy. That's why these are just 15-minute videos.
Yeah, as soon as it starts to feel a little bit better, once it's gone from that 7 or 6 down to that 2 or a 3, you need to be moving on. Don't wait for it to get completely gone.
Yeah. Sometimes when it starts to feel better, you don't want to move to the next spot yet.
Mm-hmm.
Ooh, how we doing? All right, we're getting there. Last little bit, guys. Come on. Your wrists can do it. Your forearms can do it. Shift however you have to shift. If you're up against the wall, you're probably not having too much of a problem. Oh, that's a good one.
Mm-hmm. My glute medius is a good one on this side too.
I'm in my deep rotators now. I feel it.
Yeah.
Yeah. This has been locking my hip up. All right, guys, that's around the 3-minute mark. So you can slowly come out of that pose. Okay. Get some blood flow back to those hands. Good job.
That's stretching now?
Yeah, that's challenging, but hey, your forearms got a little bit of a stretch, right?
Oh, that's true.
So now we're going to stretch our deep rotators. We're going to open our hip up. Bree is going to demonstrate in the chair. This is wonderful because you can do it at the office. You can do it while you're waiting somewhere.
Yep.
Nobody even has to know you're stretching. And for those of you who are a little bit more flexible, we are going to get into what's considered a pigeon pose. So go ahead and bring your leg out and push that other leg back.
And for those of you in the chair, you're just going to take that right ankle and put it over your left knee, just like this. All right. And what we're trying to do here is we're trying to get the knee to go down so that the tibia and fibula are nice and parallel to the floor. All right. And then from here, we're going to lean forward with your sternum, with your chest bone here. We're going to lean forward. Now, if sitting upright, you feel enough of a stretch, or even if you put your leg over your knee and you're here and you feel it already and that's as far as you want to go, just sit there. Breathe it out. You'll eventually get a little further.
Yeah, it takes time. If your hips have been locked up for years, be patient. Be patient with yourself. And if this is a stretch that you need in your life, if your knee is up like Bree just demonstrated, add this into your daily routine. Start healing those hips.
Daily, and you'll notice a big difference for sure.
Oh, it'll help everything. Every time we give somebody that stretch that needs it, it's life-changing.
Mm-hmm. Now the cool thing about sitting in the chair is you get a little bit of a different option here too. So like I said, we lean forward with the sternum of this chest bone here. We can also play with the direction. So we can play with the variation of which muscles we're stretching specifically. So I'm going to go ahead and point my chest towards my knee now. So I'm going to lean over just a little bit. And so I feel a different stretch now within my hip.
Same thing for those on the floor. And you can also take your chest over to your knee or to your heel. Okay, and let's slowly come out of that pose. If you're on the floor, even if you're in the chair, the hips can be tight. They can take a little while to respond nicely. All right, shake that leg out. Now let's do the other one. And remember, one leg is always going to be tighter, or one hip is always going to be tighter. And my right hip does not want to do this today. Hang in there. Remember, it should be a releasing pain, not an inflicting pain.
Fine line.
Don't forget you can play with your angles.
Mm-hmm. And don't forget to pay attention to your breathing here also. It's good to make sure that you're not holding your breath, you're not breathing shallowly. Full deep breaths.
When you breathe nice and deep, you tell the body it's okay to relax, it's not getting injured.
Safe space.
Okay. All right, everybody, let's slowly come out of that. Okay, and remember, your hips can be a little achy. All of your muscles, when you deep stretch them, can be a little achy. And it's up to you to really find out where that where that sweet spot is for you guys.
Mm-hmm.
But remember, try the on a pain scale of 1 to 10. If a 5 to a 7 is pretty comfortable, try and live in that 5 to a 7 space while you're doing your stretching, and your foam rolling exercises.
Yeah.
Let's see, what's up next for us? I think we're doing a shoulder recovery video next. Yeah, so you guys will have to stay tuned and check that out.